Hi, this is Janet Braun. Welcome to Competency 9, Care of Children, Nutrition. Because we just studied nutrition in greater depth and you did lots of work on that, we will have this short video PowerPoint on children's nutrition. This slide is a few reminders about nutrition related to children and everyone. Very important for children that they get plenty of protein for growth and developing new cells. Carbohydrate for the fuel that they need to run and have all that energy. Fat is not only another source of energy, but very important for the myelination of the nerve fibers in small children. And all those vitamins and minerals that we've talked about are needed to build new cells, to regulate their body processes. So the B and C vitamins, which are water soluble, have to be replaced in our diet every day. All children need them every day. And children should take a good quality daily vitamin and a vitamin D supplement at the very minimum 400 international units per day for the infant, and increasing amounts as the child is older, so their vitamin D levels, like the adult, should be checked with their annual physicals. And kids need plenty of fresh filtered water. Recommendations for infant nutrition. Infants are in the very highest metabolic rate that people ever have. Their growth rate is faster as infants than at any other time in life, so they have very high caloric needs for a lot of energy and growth. So the energy requirements you can see here change from 300 kilocalories per day at 1 month to about 800 per day at a year. So a really tremendous increase in their metabolic rate in that first year. It is recommended that babies exclusively breastfeed and have their mother's milk with no other food or beverages for the first 6 months of life. Adding supplementary foods at 6 months because their iron stores get depleted at that time, but continuing to breastfeed for at least the full first year. Supplements important for babies are that vitamin K injection that they get at birth, vitamin D 400 international units per day in drops for both breastfed and formula-fed babies, and iron-rich foods added by 6 months of age. Fluoride is recommended after 6 months if they do not have fluoride in their water. And for the breastfeeding baby, we encourage avoiding pacifiers until at least 1 month so that it doesn't interrupt their ability to build their mother's full milk supply. So what can the nurse do? The nurse needs to do a lot of teaching about all of this, and prior to the birth of the baby, of course, teaching about breastfeeding and teaching communities and childbearing women and families helps them to make that very important decision for their baby. Teaching about the health benefits for the mother and the baby, and looking at any barriers that might come in their way that can be overcome. Less illness for the entire life of the child, less risk for obesity. So being aware of lactation consultant services in the community and other resources like La Leche League, which is an excellent community support group for breastfeeding mothers. And also thinking ahead to, if we have a child who is ill or hospitalized, the breastfeeding mother then is going to need to pump if she's away from her baby, and she'll need support, getting a hold of a pump and having lactation support for that period of time to maintain her milk supply. Infant formula can be used as a substitute if the mother is unable or unwilling to breastfeed. Always teach parents to hold their baby to feed and burp the baby frequently. Usually the baby's healthcare provider, will suggest a brand of formula, and nurses are involved then in teaching parents about preparing that formula. Formula comes as ready to feed, which is the most expensive, or concentrates in a liquid form or a powder. So they need to carefully follow the directions to reconstitute the formula. It can be mixed with tap water and refrigerated so that they can put together a day's supply of formula all at once in the morning. Bottles should be emptied and cleaned after feeding and not saved to be used again at another feeding. Once the bottle is in the baby's mouth, then the baby's saliva is beginning to already digest the milk in and around the nipple, and so it shouldn't be reused after that time. So they want to just fill the bottles with approximately the amount that the baby's been drinking. Important to be careful about not overfeeding. Babies who are bottle fed, overfeeding is a big problem with bottle feeding. So spending a little bit of time calculating their actual caloric needs so the parents have a clear idea of how much the baby needs to eat and the baby doesn't get overfed. Remember, no bottles of formula or juice should go to bed with the baby, and complementary foods need to be begun at 6 months of age. At that time also the baby should be offered a cup and encouraged to use a cup at meal times, reducing the use of the bottle so that by the time they're 12 months there's no more bottle needed. Baby bottle tooth decay is a problem that affects many young children, especially bottle feeding babies, but it can also affect breastfeeding babies when milk is left to pool in the baby's mouth. So especially when babies go to bed with a bottle or are lying down breastfeeding and don't swallow before they go to sleep, the milk is still in their mouth on their teeth. So we see this child who has decay on so many of those baby teeth in the mouth already at a very young age. So parents need to be taught to brush or wipe the baby's teeth daily with a washcloth, just a clean washcloth, and never give the baby a bottle to go to bed unless there's only water in it, nothing other than water. The end of bottle use should be at 12 months, so if families can prepare ahead, if we give good anticipatory guidance, by the time the baby's getting to be a year old, they can do without a bottle, and then that really helps to prevent that problem from continuing or developing beyond that point. And most babies are recommended to visit their dentist in the first 1 to 3 years. So the introduction of solid foods at 6 months is always a big question, what to do about that. We've talked a little bit about this before. So the baby's iron needs increase at that time, so the baby needs foods that are rich in iron. Some of the richest iron foods are meats and eggs, and so we can feed babies those foods if we cook the meats moist and soft and then mash them or put them through a little baby food grinder at the table. Those become some of the best baby foods for iron supply. Egg yolk is a good source, but we should not feed the baby egg white yet because that's the part of the egg that sometimes causes allergic responses. And then adding other foods one at a time, starting with vegetables that are cooked and mashed, and one different vegetable at a time for several days before you try a new one, so that if there is a reaction to anything, the parents can tell what it was that the baby reacted to. And fruits we usually encourage to offer last because they're sweet and babies like them, and if we give them first, they may not want to eat some of the other foods. Oftentimes we see cereal recommended in textbooks and other guides, but cereals of all types are very high glycemic index foods and they are not good foods for babies, so I am not recommending feeding babies cereal, and many other people are realizing that cereal is not a good food to start our babies on. We're starting our babies on a diet of high glycemic index food if we do that. So a list of things to avoid or delay, and then soft finger foods as the baby grows in that first year. A few more general concepts about nutrition for kids. All food groups should be included in their food choices every day. Lots of veggies and fruits, important for their bowel elimination. Plenty of fresh water. So teaching our kids to drink fresh water instead of sweet things is a very important nutritional piece. Plenty of fats are needed for young children, especially under 2 years of age, for their brain and neurological development and the myelination of those neurons. So we should not limit their fats and give babies low-fat foods or no-fat foods. And we need to balance their food intake with physical activity every day. Avoid processed cereals for all children. avoid all high glycemic index foods, and feed babies and children the same nutrient-dense food that the family eats. So we want to choose foods that are low in sugar and moderate in salt and sodium. When the baby gets to be a toddler, they start to move around and explore the world around them, and their growth rate tends to slow down quite a bit. So they may be drinking a fair amount of milk still. 16 to 24 ounces is common at that time. But again, no bottles should be going to bed with the baby. By this time, the baby really wants to start self-feeding, and you can see the picture. This little child is picking up soft cooked vegetables and has the opportunity to choose which ones they're going to try. We can start to teach babies to use utensils when they can begin to handle them, and babies should be eating their meals at the table with the family. They learn table manners and it becomes a social event. So we want to do tooth care, dental care after the baby's finished with their meal. And here's information on the preschool and the school-age child. Mealtime is definitely a social event for these ages of children. They're starting to get more involved in preparing their own food. So we want to talk to kids about food and teach them why good foods are important for them, and give them lots of fun and interesting choices to choose from so they can select good healthy foods every day. Tooth care is important for both of these groups, and teaching toothbrushing and flossing. The adolescent presents lots of new challenges when it comes to nutrition. Very rapid growth period for adolescents. Physically, they're developing hormones, and there's very rapid mental development and high use of their mental capacity. So more or less than 2,000 calories per day are needed by adolescents. Boys who are physically active usually need more than that. And adolescents are preparing a lot of their own food, so this presents lots of challenges in getting all of those nutrients that they need. So spending more time with adolescents, talking about nutritious foods, buying nutritious foods so they have access to them, and getting their friends to come and prepare foods together so they can learn and share foods together. We know that fast foods are common choices for adolescents, so if we can minimize those times and minimize the use of vending machines and soda. We need to pay attention to what's in our kids' school lunches. Are they eating lunch at school? Are they taking lunch with them so they can have healthy choice at school? Here is a list of the most common childhood nutritional deficiencies: iron, calcium, vitamin D, folic acid, and the issue of vegetarianism. So a few suggestions about those concerns, and also what sources of food provide the needed nutrients. In your London textbook on page 906, there's a good chart on the clinical manifestations of dietary deficiencies and excesses that is worth taking a look at, so that when you think about doing the nursing assessment on a child in relation to nutrition, you will know some of those things to look for that might be clues. And lastly, we need to teach parents, not lastly, but always when we're talking about childhood nutrition, parents are the living example for their children, because kids are going to do what they see. So staying healthy, eating good foods, drinking alcohol in moderation, and being involved with our kids as they learn how to choose healthy diets for themselves.